Hello, and welcome to the Dr. Toomer Talks show. I'm Dr. Catherine Toomer, and I am your host for this evening and every evening, every Tuesday at 6 p.m., where I talk about all things health, wellness, and weight care related. I also am the founder of Total Weight Care Institute, where I help people get complete and compassionate weight health so that they can feel better and live a full life. And then I teach doctors also how to provide complete and compassionate weight care to their patients so that their patients live a full life, and the doctors also serve and earn with confidence so that they can have financial freedom and time autonomy. And I wanted to talk today about something that people have asked me about all the time. Now, I'm talking about the things that people come to me for. Now, I talk about weight health and weight care quite a bit. And the reason that I do that is because weight is simply a symptom of something else. But people assign a lot of their symptoms to their weight or to some type of lifestyle thing that's going on. And so when people come to me for assistance in whatever symptoms they assign to their weight, I get to look to see what is really going on. Because weight, again, in and of itself is just a symptom of something else. And that something else is what I look for. Now, I often get the complaint of, "I'm tired. I'm just tired all the time. So I'm coming to you to help me lose weight because I'm tired." And then when I start digging deeper, I find out why they're tired. And you often, the reason they're tired and the reason they're gaining weight are tied together. And so by addressing one, I fix the other. Other times, they're not tied together, and I can help the person, the whole person, because that's really important. I use what's called a biopsychosocial approach to helping people. So the biology of it, I look for, but the psychosocial, making sure that that is also addressed, because if any one of them is not addressed, it affects the others. And so before I get into the meat and potatoes of this, I want to say thank you for all of you who are listening. Please let me know in the chat where you're from, where you're listening. And, um, and if you are watching this later, let me know and just let me know where you're listening from and say hashtag replay. And then also share this with your friends and family so that they can come and enjoy some of the health and wellness that I talk about on Tuesday evenings, every Tuesday evening at 6 p.m. And so I want to say thank you, Yolanda, for joining this evening. And and so what I wanted to say was um, there are very some common reasons why people are tired. Now, there's tired that requires sleep and then and rest, and then there's tired that requires peace. And we are going to differentiate between the two. And so the number one reason though that most people are tired is because of their lack of quality of sleep. Now that's a no-brainer. We know this. If you don't get enough sleep, you don't get good sleep, it will affect your life. Now, when if sleep apnea, insomnia, restless leg syndrome are all things that disrupt sleep. You may actually have fallen asleep, but you wake up tired. And so waking up tired is a good indication that it's time to go see your doctor. Because it's not just the amount of sleep that you get, it's also the quality of sleep you get. And if it's really severe, you can always see a sleep specialist. Yes, there are sleep specialists out there, and you can speak to them if you feel like it's more than something that can be corrected by your primary care physician. The number two reason people are tired is stress. I talk about stress a lot because stress really is insidious and it just disrupts our lives on so many different levels. And we've been taught to accept it. We've been taught to not feel it, even though our body feels it and reacts to it. And so prolonged stress can cause both mental and physical issues. And it's hard to tell which came first, the chicken or the egg. But what uh, what stress does is it raises your cortisol levels, like I've talked about before. It raises your cortisol level. Cortisol, in and of itself, is toxic to our bodies. When it's in our system for short periods of time to help us protect ourselves during fight or flight, that's fine. But when it stays chronically high, it causes heart disease, it causes dementia, it causes diabetes, it causes severe weight gain. And that's usually what brings people to me is the weight gain. And they see that their weight's going up and they don't know why. And when you couple that with not getting good sleep, it often goes up even more. Now, one of the things I forgot to mention when I talked about sleep is that when you get good sleep, when you go into deep restorative sleep, your body produces an enzyme, produces a hormone that actually helps with weight loss. It's a hormone called leptin, and it is helps you feel full faster, so you don't eat as much. So one of the reasons why we eat a lot when we're tired isn't just because we're tired, it's because the hormone that helps us understand that we've eaten is not in our system. So I just jumped back a little bit, so I'm going to come back. Um, so number one, lack of sleep. Number two, chronic stress. Number three, poor diet. If you are someone who reacts to food either because of reflux, or because of allergies, or because you've eaten too much. Um, all these things will disrupt your body's ability to function. And the main thing is that a poor diet, when we eat poorly, one, we don't get the nutrition that we need, or our body's so focused on trying to digest, send oxygen to our stomach, to our intestines to try and digest the food, that the rest of us is fatigued, and brain especially. So that's why some people get very sleepy after they eat. The other is they can get sleepy because their blood sugar goes up too high. So if it's too heavily weighted in carbohydrates. And so that's why I talk a lot about protein meals, because those meals tend to not drive your blood sugar up, tend not to make you tired after you've eaten, and and also help sustain your muscle and your metabolism. So not having a not eating properly, or or sustaining a proper diet does have ramifications, both weight gain ramifications and fatigue ramifications. Now, when you talk about poor diet, a lot of times it is a lack of iron, which makes us anemic, and definitely we know anemia makes us tired. Low B12, which causes a different type of anemia, but also anemia makes us tired. Low vitamin D makes us tired. And so, and then our electrolytes, potassium, magnesium, calcium, all these things that help all the muscles in our body do their job. So you get leg cramping at night, which disrupts your sleep. Um, and the other is if you eat too little, often what happens is our blood sugar drops in the middle of the night, and that will wake you up. Low blood sugar can be dangerous. Our body doesn't like it. And so if it drops too low through the evening, it will wake you up. If you don't eat enough food throughout the day to maintain your activity, it will make you tired. So nutrition is extremely important. Number 4 is dehydration. That's one of the ones that is overlooked often. When we don't get enough water, our brain cells actually shrink a little bit. And then our brain is what kind of keeps us alert. So if our brain's not getting the fluid that it needs, it will make you tired. And every cell in your body is affected by it. And so it's really important to then drink water, drink fluids of some kind. Now, when I say drink fluids of some kind, what that means is things preferably that are sugar free, not beer, not wine. Those don't count. Liquor doesn't count either. But anything that is a soft drink that doesn't have sugar in it, and that it's just something that will help hydrate you. And the way you know if you're hydrated is by watching your urine. If your urine is a pale yellow to clear, then you know you're hydrated. If it's a dark yellow to and anything darker than dark yellow, then not only are you dehydrated, but your kidneys are now being affected. We don't want that. And so, um, oops, I think I lost a page somewhere in here. Nope, there we go. Um, so The way how to counter dehydration is to drink at least 1 ounce for half your body weight in pounds. So what does that mean? So if you are 200 pounds, your body weight is 100. So you want to drink about 100 ounces of water a day. Now, that works up to a gallon. It is not recommended to drink more than a gallon of water each day because it can cause you problem. It dilutes your blood to the point where you can have some severe and very dangerous things happen to the brain, to the blood, to muscles, and so in the heart. So you don't want to drink more than a gallon a day. In fact, it's not even recommended you drink that much each day. But essentially, to maintain your basic activity, one half of your body weight in ounces. Number five, what causes tiredness is a lack of activity. The less we do, the more tired we are. It may seem counterintuitive, but the more you do, the less tired you get. The more you do, the more you move, the more you exercise, the more your body strengthens, your body's endurance goes up. And so other activities don't fatigue you as much. And so by moving, by exercising, particularly after eating, really helps the body in not making you tired. And if you're someone who gets tired after eating, then going back to what I was saying about a poor diet, that could be your blood sugars going up, or it could be that it's, dropping oxygen into your brain because your body's now digesting new foods. But so walking after eating is actually the best way of countering that tiredness after a meal. It helps with digestion, it helps with blood sugar regulation, it helps prevent weight gain from the meal you've just eaten. It also helps reduce stress, which also changes what happens to food in the body once it's been eaten. If you're under stress and you eat food, it will become fat rather than fuel. And so moving after eating is one way of preventing that from happening. And it doesn't have to be a lot of walking and it doesn't have to be fast walking. It could be slow. It could be as long as it's sustained for like 20 minutes or more. That's really what's most important. Number six, the reason that we're tired is overwork or burnout. Now, if you work really long hours or you work in a very stressful situation, again, I'm talking about stress, um, it can leave you mentally tired, even just as much as physically tired. And when you're mentally tired, it manifests as physical fatigue as well. And so in situations like that, it is best to take care of yourself because I can tell you if you're in a job that you're putting a lot of hours in and you're allowing that job to stress you, it it can kill you, and it does, and we see this often, particularly people in high stress jobs. They tend to have lower life expectancy. But guess what happens if you don't show up to work because you no longer exist? They simply find someone else. So you can't your job will find someone else. They'll just replace you, but your family cannot. The people who care about you cannot. And so working burnout, it's always important to try and fix that situation. I know it's easier said than done, but no job is worth dying for. Um, so it's really important then, if you can, to take a break, slow down, pull back. Um, Not the quiet quitting, which also happens, but I'm talking about preserving your sanity and preserving your physical health. Number seven, which leads us to mental health issues, depression, anxiety, um, ADHD can also make you tired. Now, it seems counterintuitive that hyperactivity would make you tired, but think about it. If your body's constantly moving and you're constantly thinking of new things and you can't focus and you're rushing all the time, you will be tired. Depression, in and of itself, in the name, to depress, to pull down, to slow down. That makes you tired. Anxiety takes a lot of energy to try and counter and cope. And those things will cause fatigue. And the way to counter that is to get treated. Therapy, medication, something that addresses the coping mechanisms that um, that are required to then help pull you out of that feeling. But when left untreated, depression always gets worse. Anxiety always gets worse. ADHD often leads to other issues, bipolar disorder, depending on the type 1 or type 2. Any type of mental illness can make you tired. And I'm going to talk, but then unfortunately, so do some of the medications used to treat them. So I'll talk about that a little bit later. Um, so it's really important to get screened by your physician. Your primary care doctor can do this. Get treated as necessary and follow their recommendations, particularly if they recommend medication and therapy. It's not a stain on you or your reputation. I know that there's often stigma attached to the treatment, but better to be alive and well and treated than not to be. Number 8 is hormonal imbalances. Now, there are lots of different hormones that we talk about, but the main hormones that make you tired, believe it or not, is a thyroid, lack of thyroid hormone. It is the hormone that helps keep our metabolism going, helps keep our body moving. And when it's low, it causes us to slow down. It slows, and so it makes us very, very, very tired. It also causes weight gain. You see how they're all tied together. Now, the other is, we often hear it, lowering estrogen. When our estrogen drops and we're going through menopause or perimenopause, it does cause fatigue, mainly because it also drops testosterone, which helps gives us energy, and it raises cortisol. Now, remember, I was talking about how cortisol causes fatigue just from stress. Well, not only stress raises cortisol, so does lowering estrogen, menopause. Also, in men, dropping testosterone will do the same thing. So it's important that if you're feeling tired, to speak to your doctor so that the various things can be checked. Now, it's harder to check for certain hormones. It's very easy to check for thyroid hormones. It's very easy to check for testosterone. It's not as easy to check for female hormones when you're in perimenopause. So it's really important that you speak to someone who really knows what they're doing so that you don't get false information and you know exactly what to do. Hormone replacement therapy is always the first thing that we think of. It's not dangerous like it used to be. There are different iterations of it now. And so there's no reason to be afraid of it if that's the recommendation. And it's the reason why we have insomnia when we're going through menopause, and so it feeds back to the first thing I said about not getting enough sleep. So again, you treat the whole person. And menopause is one of those things that affects every part of who a person is. Chronic health conditions. That's number 9. Chronic health conditions can cause issues. Now, we just talked about hyperthyroidism, or hypothyroidism, sorry, that's low functioning thyroid. However, there are others like heart disease makes you very, very tired. Lung disease can make you very, very tired. Fibromyalgia, pain, related chronic disease can make you very tired. Autoimmune disorders like lupus can make you tired. So when you're very tired and you're achy and you're under stress and you're not getting enough sleep and you're not eating properly and you're not exercising, you see what's happening here because they all feed into it. So it's really hard to exercise if you're hurting. And if you don't exercise, and it makes you more tired. And so it feeds on itself. And so it's really important then to, one, check your medications and make sure your medications aren't part of the problem. The other is to talk to your doctors and find out if there's something underlying that needs to be checked. Most of these can be found in blood tests. If you're over a certain age, getting your cardiac stress tested. The other is checking for anemia. If you're chronically anemic, if you're a woman who's still having periods, then often it can be addressed by iron replacement. For men, if you're chronically anemic, you look for colon cancer, and colonoscopy is in order. And so there's lots of different things that can cause issues, but it's really important to talk to your doctor about that because they can find it and fix it. Because the earlier you find something, the more you can fix it. And especially with heart disease, sometimes, particularly in women, that is the only symptom, is just tiredness. You may not get chest pain. You may not get chest tightness. You may simply get fatigue. And the problem is that we're often chronically tired. And so it's if you notice that your tiredness suddenly changes, it gets exponentially worse out of the blue, please talk to your doctor and get checked. And the 10th one, which nobody's going to want to hear, I can tell you this because we're actually here and it's kind of, hypocritical because I'm about to say overstimulation by technology. When we are constantly looking at screens and being overly stimulated, it affects our sleep, it affects our time management, it affects our stress levels, it affects our moods, and all those things affect our energy levels. And so when you're very tired, it's really important to monitor your screen time, limit your screen time, particularly 1 to 2 hours before going to bed so that you sleep better. Being hyperstimulated right before sleep will disrupt it. And so when we talk about lifestyle changes in health, it doesn't always mean exercising or eating a certain way. Although those things help, it also means paying attention to yourself, your whole self, and getting checked. If you just can't explain why you're tired, or if your tiredness suddenly changes and gets exponentially worse, please get checked. And because your quality of life really depends on how much energy you have for yourself and for your family. And before I continue, I just want to say hello, Yolanda from Brooklyn. Hello, Chris. Welcome. Stacy Johnson from New Jersey. And Tina Kyles, and listening from South Carolina. I'm not sure who Double Sunshine of 67 is, but thank you for listening. And Bonnie says ubiquinol helps with fatigue. Well, it depends on the cause of the fatigue. So, but of course, anyone can just look that up and see if it's something that pertains to their tiredness. Someone wrote, I'm just about to go up. Let me go up here to miss the comment. Reaver Singleton says, thank you for helping women like us that need a little push because we are aging and things are changing and we got to catch up. God bless you. Well, thank you. That is true. I am aging. I'm 59 years old, so I get it. I'm 59 years old, menopausal, with type 2 diabetes and congestive heart failure from pregnancy that I, have to manage. So I understand what it means. I get tired and I don't know if it's my heart, it's my sugar, it's lack of sleep. It's, when you're young and you have symptoms, it's easy to I'll just catch up on my sleep. But when you're older, it can mean something far more serious. And so, it's always something, it's never something to ignore. If you have questions, now it doesn't have to be questions about the topic from today. Because I do, like I said, I talk about health, wellness, and weight care quite frequently. So if you have questions, now's the time to ask. The other is share my videos with family and friends, mainly because I am getting reports that people are looking into their health and they're finding things. Others are looking into their health and maintaining it and not letting things go before it's too late. And the way you can do that is by having them subscribe to my YouTube channel or following me on Facebook. But the other is I have a Facebook group that is uh, Total Wellness Plus Weight Loss or Weight Care. And I'm going to put the name of the group in the chat so that if you want to follow there, you can. It's facebook.com/total weight loss. So if you want, you can join the group and ask me questions there. You can also ask me questions on after the video on my YouTube channel. I do monitor that rather closely. So if you have questions, I will respond. Sandra asks, how do you get rid of much fat around your liver? Now, around your liver or in your liver, all of it has to do with metabolic issues. So the way you do that, first and foremost, is to talk to a hepatologist. That is a gastroenterologist who specializes in liver disease. And so you want to talk to them because fat around an organ makes it less efficient, and you need your liver in order to help detoxify your body. So the first thing you do is talk to someone who's a liver specialist, and they will talk to you about your metabolic processes. And usually what they do is they go after whatever the metabolic cause is. This is another reason why I like GLP-1 medication so much. Excuse me. They actually decrease fatty liver. They have been used by gastroenterologists for many, many years to help reduce fatty liver, which can lead to liver failure. When your liver fails, there's not a whole lot else you can do. It's one of our largest organs in our body, and it does a lot of significant work. Now, it can recover if it's caught early and it's treated. However, our liver is a very important organ. Many of our organs are important, but your liver really, really, truly is. And so GLP-1 medications actually help protect your liver quite well. Any other questions? What is the name, of the medication again for your liver? Okay, it's a class of medication. They're called GLP-1s. So glucagon-like protein. Their names of them are like Ozempic. You hear about the name Ozempic, Wegovy, Mounjaro, Zepbound, Trulicity, Saxenda, Victoza. Those are all names of GLP-1 medications. So when people talk about Ozempic and they sensationalize all the complications, they rarely talk about how they help. And one of the things they help with is fatty liver. It's a metabolic process, and these are metabolic correctors. And so they help. And they help prevent liver failure. They actually help prevent dementia. They help prevent heart disease. They help prevent kidney disease. They help prevent a lot of disease. And that's why I like them so much, because they often correct the metabolic processes that are destroying organs. Lindy Lou 2 says, I'm 65-year-old female. I'm type 2 diabetic. What could being a diabetic affect your sleep? I have been having sleep problems for years. It can, if your blood sugar is dropping too low through the night. The other thing that it can do, depending on what is done to your weight, it can cause sleep apnea. Having, your diabetes well controlled can be an issue. However, it's always important that if you're having difficulty sleeping, to find out why. Lack of sleep really wreaks havoc on the body. And so getting a sleep study to see if sleep apnea is there, speaking to a sleep specialist, following a sleep specialist on YouTube. There is a doctor. I'm going to put her name in the chat. Her name is Dr. Funke Afolabi Brown, and she is Restful Sleep MD. She just actually wrote a book about sleep. And she's a good person to follow on YouTube and on Facebook. And it's called she's Restful Sleep MD. Oop, I spelled restful wrong. Okay. So that is someone that you can follow who can she has a lot of really good information about sleep and I'm just trying to see if I can get back up. I didn't want to miss anything. Yeah, so yes, diabetes can cause issues. So can even at 65, so can menopause. And sometimes getting hormone replacement can help your sleep because our estrogen and progesterone help. Well, definitely progesterone helps with sleep, having better sleep and uh, reversing the sleep issues that we often see with menopause. Um, Jan Banks says GLC. No, it's GLP as like Paul. P1, GLP1. So when you hear all these things like Ozempic, Manjaro, those are GLP1 medications that were designed for diabetes, but diabetes causes a lot of metabolic issues, but they cause metabolic issues way before someone becomes a diabetic. So a lot of us are walking around with metabolic issues that GLP-1s help correct. GLP-1 medication is good for fatty liver, help prevent many diseases. Thank you. Absolutely. It really is a very good medication for fatty liver. Hello, Denise from, I'm going to say Cochranville, Pennsylvania. Thank you for joining. And Lindy Lou, too, you are very welcome. So the other is for those of you who are talking about sleep disruption, and I was telling you about menopause. There's another doctor on YouTube, and her name is Dr. Rachel Rubin. And I'm putting it in the chat. She's also a good person to follow she's a urologist who does a lot of work with menopause and perimenopause, and she's a very good person to follow. And so to get really good information. I'm actually taking a class from her right now so that I can do better with prescribing and using a hormone replacement. That's really how good she is. She's the doctor that all the doctors go to learn. Can you explain what collagen's for and what does it help with menopause? It depends on the form of collagen. Collagen is in food. It helps preserve in like our skin and muscle and bone and cartilage basically in our joints. As far as it's helping with menopause, it just really depends on the type of collagen and how it's taken. More likely than not, I mean, we lose collagen in our skin as we go through menopause, but that's replaced by eating and with hormone replacement. Estrogen kind of pulls collagen. When we lose our estrogen, we lose collagen in our skin and elasticity of our skin. And so the only way to maintain it is to replace the hormone that's causing it, and that's estrogen. Um, Sandra asked, what causes fatty liver? There's many things that can cause fatty liver. Anything that causes liver injury, like excessive alcohol use. The other is metabolic process, like diabetes. But some people with so there are metabolic processes that cause different things. Diabetes is one of them. Fatty liver is another. Sometimes they happen at the same time, but not always. There sometimes where genetics hits diet, hits other issues can cause fatty liver. And so it really has to be investigated by a specialist to know what the cause of it is. However, it can be treated, but the most important thing is it should be treated as early as possible because you don't want to let anything go for too long if you can help it. I have heard that cherries help with hot flashes. We hear a lot about what happens with hot flashes. The best thing to do when having symptoms is to go after the cause of those symptoms. Hot flashes are caused by hormone dropping. Certain hormones, progesterone and estrogen dropping. The best way to prevent them is to replace the hormone that's causing it. Soy, there's other things that can do with food. However, the quickest, most definitive, safest, FDA approved way to prevent symptoms of menopause is to take what's available on the market. And unless it's contraindicated, and the only contraindication would be certain types of breast cancer, not even all breast cancer, only certain types. And even then, it's up to you, because if you're monitored well and you're taking low doses, then it can be safe. Phyllis Cook John, what is my name? My name is Dr. Catherine Toomer. I didn't actually put it on the bottom here. I'm Dr. Toomer. That's why it's called Dr. Toomer Talks. And that's how you find me on YouTube. It is at Dr. Toomer, youtube.com at Dr. Toomer. And yeah, so that's my name. That's and my name and the name of the show, Dr. Toomer Talks. One of the reasons why I did not put my name in the bottom left corner is because when trying to edit videos, it gets really in the way. And so thank you for asking. And I'll make a point of trying to put it someplace so that, you can see it while I'm talking. But I am every Tuesday on YouTube and Facebook live at 6:00. And I also have a Facebook group, which I put in the chat already. And you can find me there, ask questions there as well. And I do help patients. I do have a group. I have one-on-one ways of helping people. So that I do consultations to help people determine what they need to look into, what they need to follow up with their doctor with, and do all of that, because sometimes it's just needing to know what questions to ask. Sandra says, you are a big help. I appreciate you for answering my questions. Absolutely. I love to teach, obviously. And so anytime you have questions, please ask me. I really don't mind answering. So the caveat for this evening is fatigue is not benign. If you're feeling tired, find out why and address it, because it can snowball into so many other things. It can be caused by some things, and it can cause other things, but none of them are good for your health. So it's really important to address fatigue for health reasons. Isabel says, thank you for all the info. I was out for 3 weeks because my husband was in an accident. Oh, I'm so sorry. I'm glad I'm back. I'm glad you're back. I hope he's doing okay. Yeah, accidents are scary because, again, they're accidents, so you can't plan for them, and they just sort of come out of nowhere. Well, I'm sorry. I hope everything is he's on the mend and he's doing better. Any other questions before we go? No, I'm just looking through the chat. All right. Well, again, I'm Dr. Catherine Toomer, and I'm a family medicine and community health physician, founder of Total Weight Care Institute, and your host of the Total Dr. Toomer Talks show. Oh, Dr. Phil said, oh, I came late. What do you mainly talk about, or what kind of doctor are you? I'm a family medicine doctor in community health. I'm also a weight care specialist, and my passion is metabolic diseases. And so I myself have lost over 100 pounds. I have that information. I use it to help other people, maximize their health and wellness. And so that's what I do. And so you can find me on YouTube. I have over 100 videos on YouTube. And again, it's Dr. Toomer. I have, I do the show every Tuesday. I have information that I post on my Facebook page, also facebook.com, Dr. Toomer. So you can always find me there. Oh, Stephanie Ann says, I have poor sleep and I have been taking Benadryl. Is that okay? No. What Benadryl one becomes habit forming. Two, taking is not designed for sleep. Even though it's in sleep aids, um, that's not what it's for. It's actually an allergy medicine, and so which can make you tired. It makes you sleepy. So, and it doesn't always wear off the next day. If you're having poor sleep and it's affecting your health, talk to your doctor about what the cause is. Always go after the cause, because not only does it fix it, it fixes it for the rest of your life. Okay. Um, Gerda Brown says, "Thank you so much for all the information. I appreciate you being here. I really do appreciate you guys showing up. It's always nice to get information out there." Um, Sandra asks, "How long did it take you to lose weight?" Well, I started 23 years ago. I lost the first 60 pounds in 6 months, mainly by getting my diabetes under control. It was just get simply metabolic changes, and that was before the days of the medication to help. Then about 4 years ago, 3 years ago, I was put on a GLP-1 medication. I was put on Victoza first, then Ozempic, and now I'm on Manjaro. And as a result, my weight dropped farther. So started 23 years ago, stayed the same weight for years and years and years. Then was put on a GLP-1 mainly to protect my heart, and that dropped my weight again. So, um, but just know the faster you lose weight, the more likely you are to gain to create gallstones. So rapid weight loss is not ideal. So half a pound to 2 pounds a week is really on average is what we recommend. Anything more than that, and you put yourself at risk for gallstones, which again can cause serious issues with your pancreas, with your liver, with your gallbladder. Um, Diana Hughes said, "What is the treatment for sciatic nerve? I've had it bad for 4 weeks." The treatment for sciatic nerve, first of all, again, go after the cause. Um, sciatic nerve runs through your hips. It's from your lower spine, and it is a weight bearing area. So if you're carrying extra weight, one of the ways of treating it is to lose that weight. The other is there's a muscle that spasms in that area, that it's like it causes this little triangle, and your sciatic nerve runs right through it. But when it spasms, it closes on your sciatic nerve like that. So what there stretches that will open it back up. They're called sciatic nerve stretches or piriformis muscle stretches, and you can find them on YouTube. But the main thing is to talk to your physician, because you don't want to have chronic damage, because once a nerve is damaged, it's very, very hard to pull that back. And so you want to protect your nerves as much as possible. If you are someone who has blood sugar issues or inflammatory issues, you want to watch that. Eating certain foods will make any nerve issue worse. Sugar is one. Refined flours is another. And so making sure there's no underlying metabolic issue going on that irritates nerves is another. Yeah, sciatic nerves, you just don't want to leave it for too long untreated, because it is one of the largest nerves in your body. And once it is damaged, it's damaged. And you don't want to live with that. Subi asked, "Hi, how do you feel about castor oil dealing with sleep issues?" To be honest, I'm not a sleep specialist. Um, so I know that castor oil in general helps with certain vitamins, and helps your body absorb certain vitamins, but really that's a question for a sleep specialist, because the best thing to do, again, find the cause rather than go after the symptoms. It's really important just to go after the cause so that it never comes back. And whatever castor oil is doing is probably not treating the cause of your sleep issues. So just find out the cause, find out why you're having difficulty sleeping, and treat it. be it because of stress, because of food issues, because of sleep apnea, because of metabolic issues, whatever the or your hormones are dropping and you need progesterone, whatever the reason, go after that instead of dancing around the symptom. Just go after it directly. Phyllis Cook says, Phyllis Cook Jackson, great. I really enjoyed you today. I'm glad I came across you. I have had hot flashes. I went to an endocrinologist and they said they don't really do hormonal tests. They don't. How do you get to the root of it? You talk to a gynecologist. This is coming from your ovaries. That's gynecologist, some urologist, but I would again recommend go to YouTube right now and find Dr. Rachel Rubin and start watching her videos. She's a urologist and sexual health specialist who is very well versed in menopause and perimenopause and hormone replacement. And whenever you're having hormone related symptoms, replacement is the cure for it. Again, go after the cause. What do you think about high blood pressure meds? They save lives. And there's so many different types, it's hard to say which one. Blood pressure medication should be prescribed by a physician and monitored by a physician and adjusted according to what your needs are in terms of your blood pressure are concerned. There are blood pressure medications that have dual roles. There's ACE inhibitors like lisinopril that are wonderful for congestive heart failure and for smooth muscle protection. There is beta blockers, which are used to help hearts that have been damaged, and so particularly after a heart attack. And so we use it for that. It's even used some for anxiety. There's so many different types of there's calcium channel blockers that can be used for helping with restless leg syndrome because it can be a calcium issue that's causing it. So there's lots of different things that blood pressure medications can do, and it really just depends on which one it is and which what it's treating. PD Lee says, just joining. Well, hello. You can watch the replay on my YouTube channel, my Facebook page, for the whole talk. You're welcome, Diana. So is regular sugar better than sugar substitute? Neither, really. It's kind of hard to say. It depends on what your metabolic status is. For some people, their bodies are so highly sensitive to sugar that sugar substitutes better. But anything in moderation you always do anything you're going to do, make sure it's in moderation. But if you have inflammatory processes and you have a lot of pain, eating sugar is going to make it worse. So it really just depends on the person. However, I'm a big proponent of natural. The more natural, the better. The closer to the source, the better. However, I am also a type 2 diabetic. If I eat sugar, my blood sugar goes straight up and I start having all sorts of problems. So, every once in a while I'll drink something with sugar substitute, but again, in moderation because, again, it's artificial. Our bodies don't really know what to do with artificial things. And when our body gets something artificial in its system, it just stores it as fat till it can figure it out. Karika Renee says, you spoke of getting diabetes under control. What is your best recommendation for best approach, diet or zero sugar drinks? Okay. Diet is one. Zero sugar drinks are another. So, again, go after the cause. So what diabetes is our body's inability to manage carbohydrates. So when you eat a very much of a plant-based protein forward diet and you not restrict completely, but you just monitor your carbohydrates, your blood sugars immediately start correcting themselves. Diabetes is a food-related disease, so you can use food to reverse it. However, muscle is another thing you use because muscle in our body is another metabolic corrector. So using muscle helps reverse diabetes as well. So diet, muscle, and then medication. Don't avoid medication. If your body needs it, it needs it. And sometimes you need medication just to reset so that you can use muscle to do the rest. But allowing diabetes to go on too long without treatment really is damaging to the body. Very damaging. It's one of the most damaging things that the body can experience. What's the doctor's name on YouTube? I mentioned two. One was a sleep specialist for Restful Sleep MD. That is Dr. Funke Afolabi Brown. I'm going to write her name again. And then for menopause, hold on, Dr. Funke Afolabi Brown. I would recommend, and she's for sleep. I would recommend following her on YouTube. And then for menopause is Dr. Rachel Rubin. And she's for menopause, for hormone replacement. So those are the two that I would recommend following. Okay. So Tina says, I'm trying to research inflammation. There are so many things that people don't realize cause inflammation, like additives in food. Oh, absolutely. Like I said, when our body doesn't know what to do with it, it stores it as fat. It does a bunch of other things, but there's other things our body does that are anti-inflammatory, like muscle. Our muscle puts out chemicals when we use them that help reduce inflammation. So again, the clean eating, when we talk about clean eating, what that means is you eat food that is as close to the source as possible. That's not as that's processed as little as possible. And try to do that as best you can. A lot of times people say, oh, but that's so expensive. Not really. So if you cannot eat fresh food, either because of cost or because of access, the next best thing is frozen. You can get a bag of frozen spinach that will give you much of the same nutrients and benefits as raw spinach or fresh spinach. If you cannot, because of cost or location or because of access, cannot get fresh and you cannot get frozen, at the last resort, can. It's still better than eating something processed. Better to eat canned string beans than a burger from McDonald's. Will you share the link to your YouTube channel? The YouTube channel is very easy. It's just youtube.com and then it's Dr. Tumor. It's / Dr. Tumor. That's my YouTube channel. So yeah, if you follow me there, subscribe. And you can also ask me questions there as well. Mimi Wahaba says, good afternoon. Hello. I have body aches, specifically my legs. I did scan for blood clots. They couldn't find anything. Also, most of my blood work is normal, but the pain, it comes and goes. Any suggestions? Thank you. Start keeping a diary. Start looking to see what the pattern of your pain is. Pay attention to what you're eating on the days you have pain. Pay attention to the drinking, whatever you drink when you have pain. Pay attention to what activity you've done maybe the day before, your sleep, your moods. Moods and pain go heavily together. And so what you want to do is keep a pain diary. Keep a pain diary and start seeing what the patterns are around your pain. That will help your doctors determine what to do next. Okay. What is your thoughts on next Nexaplone spelling? Oh, not for teens. Now I'm assuming you're talking about birth control. That is something that would be you'd have to talk to a gynecologist about. It's been a long time since I've prescribed birth control pills for a teenager, and I wouldn't want to speak on it, to be honest. The thing is that I can speak on birth control in general, in that if you know that your teen is sexually active and you don't want your teen to get pregnant, then birth control is the way to do it. And there's various options, and you want the most reliable way, and the most reliable way for birth control, if pregnancy prevention is the point. Leslie, anything I eat, my sugar goes up. 4 types of meds. Okay. Meds for blood sugar. Um, so what that means is the combination of the foods that you're eating are not, your body doesn't like them. And if you're talking about 4 types of meds um for blood sugar, then I you talk to your doctor. There should be, one of those meds I hope is a GLP-1, because that is the ultimate in blood sugar control and protecting the body against the complications of high blood sugar. By being a diabetic, is it better to eat vegan food? Not necessarily. It is better to eat a plant as close to a plant-based as possible, but it's very important to make sure that plant-based diet includes combinations that give you whole proteins. Vegan does not equal healthy. It just simply means you don't eat any animal products. And so, it's important that whatever diet you choose to eat, Mediterranean diet, which is a good one, um, or ketogenic diets, I don't recommend, mainly because they're just very, very, very hard to maintain. And they work, but they're hard to maintain. They're not sustainable. So, no, I do not recommend eating vegan. Vegetarian, yes. Vegan, no. And there are people out there who will disagree with me, but the only reason I say that is because it is a very, very complex way of eating, and most people cannot maintain it or sustain it. I'm not a big fan of giving anyone a task that they can't maintain, because then you feel like a failure, and it's not the person that's failing. Some frozen foods will say fresh frozen. Yeah. I mean, they are. They're flash frozen, they're frozen fresh. I mean, that's some of it's marketing, but some of it's real. And so can constipation kill you? Should you take a stool softener daily? The number one way to get rid of constipation is water. Dehydration is the number one cause of constipation. And yes, it can kill you, but not in and of itself. It usually causes backup, reflux, which can cause aspiration, which means that you can end up with food in your lungs. I mean, technically, anything in your body can kill you, but any process that's not working properly should be addressed. Find the cause. There's always a cause for everything. You go after the cause. We have a bad habit of just going after the symptoms, which is fine and you get relief. But in the meantime, you need to find the cause so that you can make it stop forever. Karika Renee says, do you eat a plant-based diet well? If so, what is the easiest way to start? I had my dental hygienist recommend a book called The Eat to Live Plan to Prevent and Reverse Diabetes, The End of Diabetes by Joel Fuhrman. Yes, actually, that is one of the books I used. Joel Fuhrman's book, How to Eat to Live. I did actually do that. Now, I don't follow it verbatim just because some of it is just, I'm honestly, I like food too much. And I feel like food is a joy of mine. It's my love language to myself, and it's my love language for other people, cooking. And so what I do is it's more modified to fit my life and my lifestyle and to give me the results I want. So I can keep my blood sugars under control. I can keep my weight under control, which I need to more and more as I'm getting older, because I also have sciatica. And if my weight goes up, my sciatica goes up too. Um, and but it is very good for keeping inflammation down. It's a very good diet way of considering food. It's good learning. The easiest way to start is just to start. Do not expect to be perfect. No one's perfect in how they do something. Even if it's just one meal a week, it's more than you did before. Then you do 2 meals a week. That's 2 more meals than you did before. And you just slowly ease into it so that it's in small increments and it makes it easier and easier to do over time. If you jump right in full head first, often what happens, it sets you up for failure and then you just actually end up reversing worse than where you started. So just take your time, pat yourself on the back, give yourself some grace, and just take your time with it and just learn it. It's just no different than learning anything else. We didn't learn how to write whole pages of things right off the bat when we were a child. We learned first our letters, then how to put them together, then how to write them, then full sentences, then, so learn things in increments. That's how we learn things best. And that's how we can incorporate things so that we don't lose it over time. Are bioidentical hormones better than traditional? Is there even a difference between the two? Is one safer than the other? Bioidentical, all hormone replacement is bioidentical hormones. That's a marketing ploy to get people to pay a whole lot of money for hormones they don't need to pay for, that their insurance should cover. Insulin is a bioidentical hormone. Thyroid is a bioidentical hormone. Yeah, it's whatever hormone makes your symptoms go away, whatever hormone protects your bone, protects your heart, protects your brain, is the safer one, because they're not dangerous to begin with. So there's no reason to worry about safety when it comes to, some of us who are older remember the old hormones that were really bad. They don't exist anymore. So the ones that used to give you really bad blood clots and the ones that used to give you, that would exacerbate breast cancer if you had it, those hormones aren't on the market. What we have now are much, much, much superior to that. Let me see. Blood type and certain foods work better. Do you agree? No, that's another myth. Blood type diets and all that sort of stuff is just a myth. It's just a way of getting people to pay for books, pay for products, pay for other things. Anytime you see anything that says this is what you should be doing, and then it says pay me to get the information, well, that tells you that that tells you right there what the goal is. So true. Keto works, but you gain it back once you stop. And if you don't know what you're doing, you'll feel like you're dying. Yeah, ketogenic diets, I mean, like I said, they work. Basically, they work in the exact same way that GLP-1 medication works, but a whole lot GLP-1 medications work in are so much easier and actually so much safer. Um, Connie says, could be low magnesium. Magnesium citrate helps, but only if you have good kidneys. Might be hard to get allopathic doctor to check your magnesium. Not necessarily, but I don't know what you're responding to, because constipation, magnesium citrate is good for constipation. It's also good for magnesium in and of itself is good for leg cramps. But um, you know, I think that there's a lot of misinformation out there, and there's a lot of people who try to divide and conquer when it comes to physicians, and they make it seem like we don't know what we're doing. And basically what we're doing is trying to keep you safe. And if it doesn't fit with someone else's narrative, usually the first thing they do is attack the doctor and our knowledge, because they want you to buy something. That's usually the case. No one ever tells you that doctors are wrong and then doesn't try to get money out of your pocket. Phyllis says, I have pain all day, every day. I notice that I feel better moving. As soon as I sit, the pain seems unbearable. I know part of it is fibromyalgia. Yeah, it can do that. What else do you suggest for bone issues such as osteoarthritis and osteoporosis? Thank you, thank you, thank you. Inflammation. But the thing is, I think when it comes to fibromyalgia and when it comes to any pain, I think we underemphasize the mood factor. The psychosocial factor is huge. When you are in pain, pain affects your mood. Your mood then affects the pain, and it starts this vicious cycle. So you cannot break that cycle unless there is a mood regulating component. That's why antidepressants work so well in fibromyalgia. Not saying it's because of depression, but you cannot have your brain reacts to pain by producing certain chemicals, and antidepressants stop those chemicals from causing a problem. When it comes to osteoarthritis and osteoporosis, those are two different things. One is an inflammatory process, one is a bone loss issue. When it's an inflammatory, anything you do to prevent inflammation, you just do it. Sugar, um, you know, protect your joints. Again, this is where weight can come in, weight health, because again, if you have any extra weight, your body has to do extra work and it's going to hurt. Osteoporosis, again, hormonal replacement. We lose bone because we lose estrogen. We go in when we go through menopause. So preserving our estrogen preserves our bone. It just does. But again, these are things you should be talking to your doctors about. And but I get follow the doctors I showed you, particularly Dr. Rubin, when it comes to things like this. Okay. What is the deal with MGUS? I don't know what that acronym stands for. So you'll have to, Ural Williams, what's the deal with MGUS? I don't know what that is. Okay. So I usually like to keep this under an hour. We've gone over. So Ural, what you can do is you can, I'll see that question on Facebook, but you can ask me. I just don't know what it stands for. And I'll look it up, but I know a lot, but I don't know everything. So, well, thank you all for coming. Thank you for these great questions. Oh, this was wonderful. I love this. I love answering questions. And again, if you can ask me questions on my Facebook page, you can ask me questions on my YouTube channel, and you can join my group. And if you can't find it, all you have to do is send me a message on Facebook and I will just send you the link. Thank you so much for taking the time to answer. Absolutely. I love to teach. This is why I do this. This is why I do what I do. I've been in medicine now for 30 years, almost 30 years. If I don't take the time to answer, who is? I mean, I learned that I'm in one of those old school doctors who learned that, like you said, the biopsychosocial system, you treat the person, not their numbers. And that's how I function. So, all right. Well, I'll see you all next week. Share this with your friends. Let people know to tune in. It's always wonderful to see new faces and new names, and new names and the little faces in the little circles in the to the left. And you said Dale Price said, I hate that I missed it. I've got one good question. I mean, I'm still here. So if you got a question and you hurry up and write it in, I'll answer it. You got about 1 minute and then I'm going to have to go. Thank you. Oh, well, thank you all for coming. This has really been, I appreciate you tuning in. I appreciate you listening in. And all I ask is just you share this, I like, I want to spread the word. And so just spread the word for me. Tell your friends, tell your family here Tuesday, or follow up, because it's like I said, it stays up. So it's not like it goes away. Dale said, I've got high cholesterol and don't want to take statins. Okay. How high is your cholesterol and do you want to die? I mean, you don't have to take statins, but I can tell you it's really hard to get your cholesterol down any other way. And if you don't get your cholesterol down, particularly if it's a lipoprotein A, it will cause you problems. So statin is far less dangerous than the heart attack you'll have if you don't take it. And I'll just be blunt. That's just the truth of it. Sarcoidosis, what do I know about it? I know it's an inflammatory process, and there are specialists out there who know way more than I do. And what I do is help look for it in patients, but once it's found, I refer. Because Dale said 299. It really just depends. I mean, that's a discussion you can have with your doctor, but I wouldn't personally. I would not walk around with the cholesterol that high if it were me or a family member. The only thing is, Dale, is that, and this is something to keep in mind. I'm assuming that you are a male because of your name. If I'm wrong, you can correct me. But one of the things you want to make sure that your cholesterol doesn't go too low, because your body actually needs cholesterol to make testosterone. So you want to get it down below 200. Um, and so if you get it down below 200, you want to stay just below 200. Anything lower than that, you might start getting to the point where your body just cannot produce testosterone you need. Sandra says, I was just strolling and glad I ran across you. You are a big help. Oh, I appreciate that. Tracy, I have sarcoid of the heart. Oh, wow. Yeah, that is, as someone who also has heart disease of a different type, I know it is just one of the things I do recommend. However, talk to your doctors. If you have heart disease, one of the biggest mistakes that we make as physicians is we never put our heart patients on an antidepressant. When we have heart disease, our body, we just go into depression, and it's protective. So that's something you want to talk to your doctor about, especially if your moods have changed since you were diagnosed. What's your name, doctor? Okay. My name is Dr. Toomer, Drtoomer. From now on, I'm not going to leave my name off. I'm just going to keep it up there. Used to keep it up there, but it made it harder to edit the videos. So I'm just going to not do that anymore. So I am Dr. Toomer. That's Drtoomer. That's who I am on Facebook. That's who I am on Instagram. That's who I am on LinkedIn. That's who I am on YouTube. And YouTube is where all these go. So I'm streaming right now into YouTube, and you can, go back and watch some of the older videos. Bonnie Sweezy said, I've been on Ozempic for over a year. I have done so well on it. I know that about a day or two after taking my injection, I am very tired. So I give in on those days and take a nap. Well, yeah, listen to your body, but also make sure that you're eating enough. And that's not the reason that you're getting tired, because that's also a possibility. But yes, any metabolic medication, any medication in general can make you tired, and listen to your body and do what's necessary in order to stay well. But I can tell you, being a little bit tired is far less dangerous for you than the metabolic process that Ozempic is correcting. You want it to be corrected. So, okay. Well, thank you all very much for joining in. And again, share with friends and family. I'm here every Tuesday, 6 p.m. for the Dr. Toomer Talk Show. So, good night.